We're back to Chapter 7, Outpatient Services in Primary Care, and this is Lesson 2. Lesson 2 is about outpatient care settings and methods of to be given in a home health setting. Mount Sinai, for instance, has a program for visiting physicians for their geriatric population, patient population. So let's start off by first talking about outpatient care settings. So that would be part 1 of lesson 2. We'll look at the different types of outpatient care settings. The first one is private practice. So private practices are comprised mostly of either group practices or solo practices. A big majority of private practices provide primary care and other ambulatory services, like office-based subspecialists. An example would be a urologist or a cardiologist. A urologist, for instance, can perform procedures like biopsies. Um, Biopsies, as we know, are procedures wherein a tissue sample is taken from the body, and that specimen is used and examined to diagnose certain types of diseases like cancer. So despite these capabilities, private practices offer limited examination and testing. So follow-up care may be needed, and it might actually require an inpatient setting confinement for the particular patient, depending, of course, on the severity of the disease that was diagnosed. Now, patient visits in private practices tend to be short in duration. A typical primary care visit could usually last between 15 to 20 minutes. But just remember that when we say 15 to 20 minutes, we're not taking into account the waiting times that you might have to go through sitting in the waiting room and then being roomed in and placed in the exam room and still wait another, say, 10 to 15 minutes before the provider comes in. All right, so something we have to remember about private practice and solo practice is that we don't see as many solo practices anymore. The reason is, very few graduates of residency trainings, those physicians that train, when they're done, a lot of them are actually not setting up their own group practices, and there are several reasons for this. And one of them is the rapid change in the healthcare delivery system, or in health plans basically have networks. So it's easier for providers to become part of a network and have a bigger patient population in their panel. They're part of a group. Also, it's very hard to compete against medical systems or hospital systems that have their own outpatient care clinics. And then the overhead cost of starting your own practice it's literally the same as like starting your own business. You have to put in capital, and of course, if you have your own business, you'll have to do your own billing. The complexity of billing and collections. We have a multi-payer system. Remember, we don't have a single payer system in this country. And then there's also a lot of external controls over practice nowadays, and most of them are not only regulatory, but also, again, it goes back to the changes in the healthcare delivery system in terms of how insurance companies actually dictate them. So being a part of a group practice or working for a medical system, an integrated delivery system, can offer the following benefits. So you have a patient referral network, meaning if you're part of a network, it would be easier for you to refer your patients for other types of services, for instance. And then if you're part of a group practice, as I've mentioned earlier, it's easier, and you have more clout and you have more weight in negotiating with insurance companies for reimbursement rates, for instance. And also, if you're part of a group practice, you share the overhead expenses of operating your own business. And then whether you're part of a group practice or you work for a medical system, there's an ease of obtaining coverage from colleagues for personal time off. So if you want to go on vacation, you cover each other, the other doctors there in the practice, or the other providers. If you are the one who owns your business and you are the only physician or provider in that business, it's going to be very hard for you to find coverage for your patients if you have to go on vacation. There's also a growing number of instances where there's sign-in bonus. We're talking about working for medical systems. Sign-in bonus, um, attractive salaries, good benefits, profit-sharing plans, incentive plans. You get rewarded for meeting certain criteria, standards of care, and things like that. And for this reason, most young physicians find that these advantages far outweigh the attraction of being an independent practitioner, which can only be achieved if you start your own solo practice. So, hospitals or medical systems or integrated delivery systems have their own outpatient services, and they're normally, um, they're very, very common in New York City. We see them both in public hospitals, those that are owned by the city, and also the private hospitals. All teaching hospitals that have residency programs operate outpatient services for both primary care and also subspecialty care. And this is part of the training, the curriculum for resident physicians or the fellows that are undergoing their subspecialty training. And because of this arrangement, and because it is in an inner city environment, and most inner cities, by the way, especially the poor neighborhoods, are designated as medically underserved areas, these facilities have become an important source of care for the poor and the uninsured. And hospitals located in underserved areas, they provide ambulatory services to these patients. Most of them lack health insurance or don't even have health insurance, and therefore do not have routine access to private practitioners. And then centers that are affiliated with teaching hospitals, they provide research-oriented specialized services, and because they're part of this bigger medical system, they have the capability of referring their patients to other subspecialties. Some of them have, even more than 100 subspecialty departments. Um, Outpatient care settings that hospitals operate, they're also important sources of income for these medical systems because of Medicaid reimbursement. So most of these patients are probably Medicaid recipients to start with. And in terms of overhead expenses, most of the physicians that actually man these facilities are not what we call attending physicians yet. So they are physicians in training, and therefore their salaries are not as expensive as the attending physicians. Now, these outpatient services can be broadly classified into five main types. So let's start with the first one, clinical. So clinical services often correspond to the services provided by private physicians in their offices, but the hospital-based ambulatory surgery centers is also an example. They provide same-day surgical care. Surgical clinic group may include general surgery, orthopedics, urology, plastic surgery, maybe even rehabilitation. And surgical care is usually episodic, and it's also short term. And this could result from referrals, within the system, referrals from primary care. Now, the emergency department has been a vital outpatient component of most community hospitals. The main purpose of this department is to have services available round the clock, 24/7, for patients who are acutely ill or injured, particularly those with very serious life-threatening conditions that require immediate attention. The emergency department offers prompt hospitalization if needed. So if you're seeing an emergency department and you need a deeper level or a more intensive type of care, then you're probably going to be admitted. So it's like your gateway towards receiving inpatient services. Another thing that hospitals have done is that they have started operating their own home health agencies. They mainly provide post-acute care and rehabilitation therapies for those patients that have been discharged from being an inpatient or somebody who received inpatient services in the hospital. Now remember, because of the requirements of insurance companies and regulations, you know, patients being readmitted into the hospitals within 30 days for the same condition, that's something that is being closely monitored. So by providing home health care, these patients that have been discharged can actually be taken care of at home. And this greatly eliminates the possibility of them being readmitted for the same conditions within less than a month of discharge. Now, women's health centers specialize in meeting the healthcare needs of women. Um, Starting in the 1980s, um, you know, women's health has become really popular, and it's been really recognized in the healthcare system as a major health market. And a lot of medical institutions develop their own specialized women's health services. It could be hospital based, hospital affiliated. They offer obstetrics, gynecology, primary care, women's health centers. They offer mammography, ultrasound, osteoporosis, other health screenings. So even primary care clinics, these outpatient service clinics that hospitals operate, they may have their own women's healthcare team in there, and that's mostly what they do. They do prenatal care and all those specialized care meant for women's reproductive health as well. So now let's talk about freestanding facilities. What are freestanding facilities? So freestanding facilities are those sites that provide healthcare services but are physically separated from the main campus or the main building or the main location of the hospital, the, the main campus of the integrated delivery system. So in this case, as patients come at their convenience, seen on a first come, first served basis, and since they're walk-in, they do not require appointments. And a perfect example would be urgent care centers. Urgent care centers or urgent care clinics usually have extended office hours. They stay open late at night. They're even open uh, during the weekends, even Sunday. They may have shorter hours during Sunday, but most of them still are open during Sunday. Um, so when do you need urgent care? Um, the recommendation is that when your health issue needs more than just a first aid kit, but also does not require a visit to the emergency department. So that means it's not life threatening, and your primary care is unavailable. So things like the flu, an asthma attack, muscle aches, sprains, rashes, vomiting, diarrhea, strep throat, upper respiratory infections. They could all be treated in urgent care center. Now, we have to remember that urgent care centers have state-of-the-art equipment and technology. They have their own x-rays, they have their own EKGs, they even have their own MRIs, some of them have their own MRIs. That's not very common, but at least they have the x-rays and EKGs. And then most of them, they have their own labs. They collect their own specimens, and they do you know, they do the laboratory healthcare services in the area. They would grow cultures and things like that. They do their own diagnostic testing. And also, for the most common illnesses, for instance, that require medications, such as certain infections that require antibiotics, um, urgent care centers have those medications already. And you don't even have to go to the pharmacy to fill your prescription for that. So when you leave the urgent care center, you will have your medication with you. Now, another freestanding facility are surgical care centers or surgery centers. They perform mostly routine, non-emergency, and for the most part, uh, they perform elective surgeries. Uh, so they are mostly independent from hospitals or integrated delivery systems or medical systems. So because of that, they are not only freestanding facilities, they are also referred to as standalone facilities because they're not part of a bigger system. Patients usually are admitted in the morning hours when the office opens, usually around 7 a.m. And then the surgery and the recovery may take an entire day, but everything is done within the office hours, prescribed office hours of that particular surgery center. Um, so the patients only stay for the duration of the surgery, and that includes recovery. Patients will not be admitted for overnight stay because in the first place, most of these facilities they're not accredited to do so, and they don't have the necessary capability and therefore the accreditation and licensing to have patients stay overnight. And patients often, actually, for the most part, they need a companion or at least somebody to pick them up at the end of the day when at the moment of their discharge. Now, last but not the least type of outpatient care setting are what we call freestanding emergency departments. So, freestanding emergency departments is considered a very innovative, and it's one of the newest models in making sure that emergency care is available for a certain given community. It is a freestanding facility, but not a standalone facility. That means it is physically detached from the main campus of the health system, of the hospital system, but it is not standalone because it is part and owned by a hospital system. As a matter of fact, if you're going to operate a freestanding emergency department, you need to be part of a comprehensive integrated delivery system, and they're meant to serve communities with immediate and serious healthcare needs, especially those areas where there's no immediate hospital. Uh, you have to remember, for instance, that it's not just distance, but also the density of the population. So when St. Vincent's closed, for instance, in the Chelsea, South Chelsea, Northwest Village area. The nearest hospital is actually across town, which is Beth Israel. So now what we have there is a freestanding emergency department owned by Lenox Hill. Yeah, that's one example that we could talk that we could actually use. So patients do not stay overnight. If they do, they will be sent to a full-service hospital. Usually, if a patient admitted in a freestanding ED emergency department is deemed needing inpatient stay, they will be sent to the main hospital that owns that emergency department. Um, most the sites where this freestanding emergency departments are, they're mostly uh, previously owned by insolvent hospitals that went belly up, and they were acquired by larger medical systems. So in the case of Healthplex in Chelsea, West Village, owned by Lenox Hill, so that's now owned by Lenox Hill, but that area was formerly owned by St. Vincent. The former Westchester Square Medical Center is now also a freestanding emergency department, which is operated and owned by Montefiore. Um, and Montefiore was actually the first one who to do this. So this is the end of lesson 2, part 1.